So how many of you have prescribed a band walk? It's a super common exercise in the physical therapy world, usually given to target the glute med and the glute max for those dealing with back, hip, or knee pain. The problem with the traditional band walk is that there's two main areas that are neglected. The first is the overall execution of the movement. Usually it's thrown in as a warm-up and there's little to no thoughts and it's just not that effective. The next is the overall position. Our patients' and clients' starting position is really going to dictate if they can even find those muscles in the first place. So in this video, what I want to do is provide a better band walk sequence. A sequence so that your patients and clients can first move into the necessary space to find those muscles so then they can contract them and maximize their band walk. So before I demonstrate this new sequence, let's go back and revisit the two main problems. The first thing we said is that it's usually poorly executed. And usually this is because there's not enough intent behind it, which comes back to really not knowing why we're doing it. So that's why understanding the overall position and pattern and changing that really helps to improve performance and execution of a band walk. Now, in regards to our second problem, a lot of our patients and clients don't start in an optimal position. And this actually comes down to the two primary muscles that we're looking to target or strengthen in the first place. And those two muscles are the glute med and the glute max, like we already said. So to understand how and why we want to sequence a band walk, let's reconsider these two muscles really quick before we get into the demonstration. Now, when it comes to the glute med, a lot of us think hip external rotation and hip abduction, but miss the third component, which is hip internal rotation. That anterior aspect and fibers on that anterior side of the innominate are really going to help to control internal rotation. Now, this will be a big component in the band walk sequence, so remember that when we actually go to coach it and demonstrate it. Now, with the glute max, we often think of it as a big hip extender, such as getting us out of a deadlift or the ascending portion of a squat, and an external rotator. Well, if we think about hip extension, I think it's really helpful to visualize it on the pelvis. What is required for hip extension is compression or a concentric contraction of the glute max. What does that look like? It's just going to press and push. So just the opposite is true for our eccentric, or if we go into hip flexion, we need to have space here. This is going to be more of an internally rotated position compared to our external rotation when we push out. Well, the problem is some of our patients and clients are starting their band walk already overly compressed back here. They don't have the ability to expand. What is this going to do? It's going to just create more compression and drive dysfunction on top of an already dysfunctional pattern. This is when we get our patients and clients stronger in their painful patterns. Besides that, it doesn't really do anything for that glute, right? If this is contraction of the glute, if we just look at one side, and this is lengthening or relaxation, if they're coming in and they're already expanded here, all they're gonna be doing is trying to get more, but they're already at their end range. For a muscle to be effective, it needs to go through its full lengthening phase to then go through its full contraction. So again, we're not efficiently working the glute, but we're also probably going to contribute to their painful pattern. So what do we need to do? Well, we need to get opening and space back here. This is more of an internally rotation position. And then we need to go and close it down. And then we need to go back and open it. That's what's gonna really help the glute. And we can do it when we start to work the glute med in a right way and we start to move the pelvis in a right way. And essentially when we start to improve movement variability for our patient. So for our band walk sequence, the first round, we're not going to perform the typical band walk. Instead, we're going to promote internal rotation strategies. What is this going to do? This is going to help us to promote the glute med in the right way. It's also going to help to promote space back here and provide eccentric length for that glute. Then the next round through, when you go through your band walk, then you can promote more of your typical hip abduction and external rotation. This is at least getting your patient the movement variability to open and close. So when you're trying to work that glute med and glute max the second time through, you can optimize that and effectively recruit the proper muscles. All right, so for the first sequence, we are trying to promote internal rotation on the lead leg. Again, that's gonna work on opening this posterior lower pelvis, going through an eccentric lengthening phase of that glute. So then the second time, when we go to our typical band walk procedures, we can actually have the muscle go through its full range of motion. So the first part of the sequence, what you want to do is really work on shifting. So I want to walk you through it so that way you know how it can be coached and what your patient or client should be feeling. So you can have a band around the knees or the ankle. I don't have one now for demonstration purposes, but feel free to throw one on if you would like. So what you're thinking about is you're still going in this horizontal direction like you would do for a typical band walk. As you take a step, you're then going to shift. The shift is really important because your patient or client must find their back pocket. So they need to feel a stretch, a muscle burn in this back pocket. That is that glute eccentrically lengthening and also this glute med, the internal rotation fibers working. So as we step, we're shifting, and this is what you want to cue. We want elbow to be in front of the knee. We want the knee to be in line with the first or second big toe. Don't let the body bring it out or don't let it collapse. And also, this arm goes back. The wrong way is just a lateral shift. So you see how my nose isn't going over my toe? I'm not shifting my whole body, I'm just doing a hip shift. Again, we're shifting, elbow goes over the knee, nose goes over toe, and then knee goes over the toe, and we're gonna straighten this other leg out. Right there, I feel a nice glute stretch and this glute med working. Then all they're gonna try to do is to hold on to that as they then step out. So when they step out of this, they're not standing, they're trying to remain exactly where they are. So one more time, they go into the step, they shift, nose over toe, elbow over knee, knee over toe. Make sure we don't allow that to go in. You might have to hold that in a little bit. Back arm goes back. Hold until you feel that. Then you're gonna try to step out without lifting, and you should feel that glute med and glute max working as they lift the foot. You would then continue the sequence for however long you feel is necessary. Next, we move to our second phase. Think of this as your traditional band walk. We just went through and did the first phase on either one side or both sides, depending on what's going on with your patient or client. The first phase goal is to create space and improve that mobility. Now we can actually contract and go through that range a little bit more effectively. So when it comes to the band walk, again, we talked about in the beginning, part of the problem is there's not enough thought. Well, hopefully just by switching to this sequence, you're putting more thought, which will then carry over into a better execution. But what you want to think about with the traditional band walk is that you're just being a little bit more stable. A lot of times people just do this and there's so much momentum from the trunk, there's so much momentum from the hip. Again, it usually leads to ineffectiveness and kind of a waste of time, to be honest, right? So if you're gonna do it, put the time into it and make sure that it's performed and coached correctly. So all we're thinking about here is being a little bit more stable, a little bit more engaged, and when we're going into that motion, we're stepping, we are controlling, and then we're going back. So again, control, step, shift a little bit, and come back. Really making sure that we're not just using our spine and trunk for momentum, which is super common, and making sure that our patients and clients aren't just going through the motions, but they're more engaged in performing each motion with more intent. And in this one, it's gonna be a little bit less of that glute. You still should feel it, but a little bit more of this side pocket like you would think. So I hope you found this to be helpful for your coaching, but also to provide more value to your patients and clients. Remember, the big summary here is that we are searching to create more space for those patients and clients that are already too compressed. Why? So that we get them out of their painful pattern. We start to improve their movement variability. We do that with providing a little bit more internal rotation strategies to get the glute to expand or eccentrically lengthen. We're going through one phase or sequence of that, and then if you want to do your normal band walk, do it after. You're putting them in a better position. They now have more range available to them, so then they can capture the true range and the true muscles that we're looking to capture during their typical band walk. Now, if you find this interesting and you want to continue to level up your coaching, check out our Performance Redefined course. I will leave it in the link below, but this is our self-paced program where we are really trying to raise coaching standards so you can maximize your outcomes. If you have any questions, leave them in the comments below and I'd be glad to answer, and I will see you guys in the next video.